emergency support for small businesses and potentially expanding eligibility for government relief and the loan program that had been put on the table for small business owners. We can also expect, of course, that the crisis in Canada's long-term care homes that will also be on the agenda. The Prime Minister is expected to speak with provincial and territorial leaders later tonight at 6 p.m. Eastern, and he's said that he wants to talk about those issues as well. A couple other things to remember today, and this is probably of vital importance for many of you. The CERB, the Emergency Relief Benefit that many of you have tapped into already and that the government expanded as of yesterday, you have maybe already applied. That was for the period from March 15th to April 11th. You can now apply for the next 4-week period from April 12th to May 9th. So if you are using that benefit, if you are counting on it, important to go and re-enroll for the benefit each month, and that is possible for the next segment of payments that are supposed to last 4 months. Just wanted to make sure we mentioned that because I know many of you are very reliant on that benefit. So please go and do that if you need it. All right, let me bring in my colleagues, the CBC's Catherine Cullen and Vashi Kapelis, host of Power and Politics. Good to see you both. April 16th also marks another sort of glum marker, and I know we'll be asking about this during the press conference later. When we initially got those modeling projections this time last week, the short-term trajectory that we were given for April 16th modeled about 500 to 700 deaths, and we are now at over 1,000 deaths. So we have not met what that projection was. Of course, we know modeling has a lot of flaws, and it is not supposed to be a perfect science. And it'll be interesting to see what the explanation is for why those numbers are so much higher. It may indeed have something to do with the long-term care deaths that we have seen spike in this country, but another thing that we should keep our eye on. Vashi, I'll go to you to start on what we are expecting from the Prime Minister today.
Yeah, as you signaled there, Rosie, look for information for businesses. April 16th, you mentioned, as far as projections, is sort of a date to watch. It's also a date to watch, for example, for business owners who couldn't pay their April rent in a province like Ontario, where landlords now have the ability, as of today, to kick them out because of that. And we have heard from a number of them. The announcement today, my understanding is geared to that commercial rent issue. The government has heard from people as well on it, and specifically the Seba Loan. That's the loan the government initially proposed that would be $40,000 interest-free for a year, and then $10,000 of it can be forgiven if you pay it by a certain date. The caveat to it is that it's restricted to people, or businesses rather, with a payroll between $50,000 and $1 million, and that excluded some smaller businesses, really smaller businesses, who, for example, pay themselves through other means, sometimes dividends, or sometimes just take a small salary, the two of them, or if it's a couple, let's say, for example. Again, people that we have heard a lot from. So what I'm watching for is to see whether or not those restrictions are relaxed and to what degree. The other caveat I would add to it, though, is given today is April 16th, given that the wage subsidy, for example, is still 2 to 3 weeks off from being accessible or even available for an application, there is still a lot of concern from businesses about A, the fact that to access any money, they're going to have to take on a lot more debt, but B, is that even enough money? Think about a restaurant, for example, in Toronto and Montreal. That $40,000 might get them 1 month's rent, maybe 2 months' rent, pushing it maybe towards 3, but it might not sustain them through the duration of however long this takes. And so I'm curious to see from the Prime Minister what else this government has for businesses, for small businesses particularly, and how exactly they might relax the conditions or the prerequisites of accessing this loan money, this emergency loan money, and how many more people might be able to access it now.
Yeah, some of those micro businesses. We talked to a tattoo store owner the other day, and he was his only employee. So exactly, would it be able to help people who have very small businesses? And my producer Phil reminds me that this program, this business account, was only officially launched last Thursday. Correct. That's how quickly time goes, and it's already being tweaked to deal with other concerns, as you talked about. Catherine, I'll go to you on the G7 leaders meeting, and I can come back to you, Vashi, too, to weigh in on that. We know that it already happened this morning at 8:30. Is there anything else that we know about how that went and what kinds of things were talked about there?
Yeah, the reports are just starting to emerge. We have a little bit of information from the Prime Minister's office that I've been speaking to, Rosie. They're saying that the emphasis was on global cooperation on health and coming together around the science, rebuilding the global economy, help for vulnerable populations. Now, I did ask that question about global cooperation. Does that mean that the Prime Minister raised the question of funding to the WHO? People will probably know that, of course, Donald Trump said he was putting his country's contribution to the WHO on pause. That is a major source of funding for the World Health Organization, somewhere in the neighborhood of $560 million Canadian, that has now been put on pause while the Americans review their work with the WHO, and Donald Trump raising a lot of questions about whether or not the WHO was perhaps too susceptible to pressure from China, saying that the WHO made some bad decisions. He, of course, being criticized by many in his own country about some of the decisions he's made. But I was told by the Prime Minister's office when I asked whether Canada raised the WHO that it was a more broad discussion than that it was really about global cooperation. Certainly that is what you see coming from, for instance, the Europeans. That's noted in their press release. There are reports coming out, though, saying that German Chancellor Angela Merkel specifically stood up for the WHO. So we're going to want to hear a little bit more, I think, about how all of that played out and what impact it may or may not have on Donald Trump.
Yeah, Vashti, I'm going to get you to weigh in on that too, just before I go to my guest, before the Prime Minister emerges in about 10 minutes' time, because this is a delicate balance. I think, asking questions about the WHO and certainly asking questions about China's sharing of information makes a lot of sense. But, is it the right time to suspend funding in the midst of a pandemic? And then what happens moving forward to the WHO if people are not contributing up to the same amount?
Yeah, it's a great question. I think that in Canada's case, it seems clear that there's no desire nor pressure being applied to withdraw funding. There are other countries, other allied countries, that also don't feel like withdrawing funding from the WHO at this point is the right move. That leads to sort of a follow-up question, though. If not that, then what? And should there be a greater level of skepticism towards the WHO if, in fact, they have been too overly reliant, as Catherine points out, the criticism has been, on data and information coming out of China? There are liberals, for example, Erwin Kotler, who says certain Chinese officials should be sanctioned, or former ambassadors like Guy Saint-Jacques who say there's too much at play right now to go in strong on China, but afterwards there should be a full investigation. So I think there can be more additional sort of questions towards the government about that and scrutiny on what actions they're prepared to take. But agree, it's a delicate balance right now, considering so much of the personal protective equipment our healthcare workers need is dependent on supply chains based in China.
Okay. I'm going to put you two on hold, if I can, just for a moment, and turn to the other issue, of course, that is of grave concern in this country, and that is the outbreak inside long-term care homes. They have become the major focus, really the epicenter of this pandemic. Nearly half of all deaths from the virus in this country have happened inside those facilities. Eatonville Care Centre is in Toronto, and it is one of many with an outbreak. 30 residents have died there so far. Jacqueline Mitchell's mother lives at Eatonville, and she joins me now from Kitchener, Ontario. Hi, Jacqueline. How are you doing?
I'm doing okay, thank you.
Okay, tell me how your mom is. Your mom's name is Lena, I believe. How's your mom doing?
My mom, I last inquired about her last night, and she, at that time, was doing well. She has not had any of the COVID symptoms, the coughing or the breathing or the high temperatures. So she's doing well, and that's good.
She's 94, is she?
Yes, she is.
She's 94. So there is obviously an outbreak in the home, and 30 people have died. So how concerned are you, or what are people in the home telling you about how they are protecting your mom, Lena?
Well, initially they told us that all the residents were kept in their beds, that they were no longer allowed into the dining room and, the open facilities. And there's a curtain that separates my mom from her roommate, and that's about it. So she's still in a semi-private accommodation, separated by a curtain.
Does that feel adequate to you?
No, it does not. Because, I know that the distance between the two beds, it's not 6 feet.
Right.
So it's just a curtain. So
she has to be moved, if I understand too, from bed to wheelchair. So is anyone getting her out of bed in order to make sure that she doesn't get bed sores or become sick in the bed? Do you know if that's happening?
I don't know for a fact, but I actually, as you mentioned, bed sores, she has had that in the recent past, and I know that they were managing it appropriately. So I'm not specifically worried about it because it's something that we try and keep on top of.
Yeah.
In terms of that. So.
Has she been tested? As you know, the Ontario government is changing a lot of the things that are happening inside these care homes, and one of them is testing. Has she been tested for COVID-19, or has her roommate been tested?
Well, I don't know anything about her roommate because they would not. Like, I have asked the question, like, can you tell me if that person is among the 53 or whatever the numbers keep changing to be, who are infected or deceased? And they would not tell me that based on the other person's privacy. But my mom, when I did call last night, they did say she was tested yesterday and I could expect results in 48 hours to 7 days.
That's good, I guess. Have you, so your mom has Alzheimer's, I think. Are you able to communicate with her? Have you had any communication with her since this started?
No, I last saw my mom on March the 9th. And no, I have not been able to communicate with her. Their home did offer a Skyping or FaceTime option, but because of the nature of her Alzheimer's, that isn't always very practical. That is not practical because she is sometimes non-responsive. Mm-hmm. So she would more respond to touch or physical closeness than to, like, she can't relate with a phone, right?
Sure. How do you think that she is getting the care that she needs right now in order to protect her from the virus if indeed her test comes back negative?
I don't want to bash the home. I think they're doing their best in a bad situation. But personally, no, I don't think so. I think the nurses, they're giving her the best attention that they can. But I think it's almost, I would call palliative in the sense that there's nothing they can do. They're trying their best. My mother takes about an hour to have breakfast or an hour to eat. She tends to pocket her food. We had a private person in there doing that for us, and we were paying that person privately. Mm-hmm. There's one PSW that I guess might be assigned to, I don't know what number of residents for breakfast, let's say, and for feeding. Mm-hmm. My mother cannot feed herself, so I have to trust, and they have told me that they would say, well, she ate well or she didn't eat well. Mm-hmm. But I don't think they have the ability to sit with her for an hour to make sure that she finishes her meal. So that's why I say no, I don't think. Like I'm concerned about her personal well-being and whether she's eating well and whether or not, her not eating well is because they don't have the time to feed her, which we understand they don't because, they have a number of people to feed, right? So it's hard.
Yeah, it is hard. When you hear about the number of deaths inside this home and in other homes, how worried are you about your mom? Did you think about pulling her out of the home? Is that even an option for you?
Well, they did, back in around April the 2nd, they did say to us that if we wanted to bring her home, we can, but we had to demonstrate to them that we were able to take care of her at home, which we cannot. So it's a false choice we have, right? We can't bring her home, and they can't take care of her, they can't protect her from COVID. So what are we to do? We just sit here and wring our hands, okay? So it's hopeless. It's a sense of hopelessness because there's nothing we can do but sit and wait for a possible COVID diagnosis. If she comes back negative tomorrow, that's because she was negative 2 days ago.
Yeah.
But is she positive today? I don't know. So it's this sense of dread.
Well, I'm really sorry you're going through this. This is unimaginable, and I know so many Canadians are experiencing this right now. If you could say something to the Ontario government, to the Prime Minister, who's going to come out of his house in a minute, about what you need for help or what older Canadians need for help, what would you say, Jacqueline?
I would say older Canadians need to hear from the government that there is a long-term strategy. For COVID, the damage is already done. We're in the middle of it. The disease has seeded throughout the long-term care facilities. Like, stopping the PSWs from working does not mitigate the existing risk. It is so great already for people like my mother. Sure. I don't know how that, removes the fact that it's seeded everywhere. So we really have to look at how to continue to mitigate the existing risk, but long term, what are we going to do to protect people like my mother? I mean, like the whole industry, starting from the home care with the CCAC before my parents were moved into a home. They have the Red Cross and other people coming into homes daily to assist people. Right. Like that whole system to me is broken. Yeah. So I think we need to deconstruct the thing and then rebuild it in a way that,
Yeah. Jacqueline, I'm going to go to the Prime Minister. I'm wishing you and your family the best, and I hope your mom does okay. Thank you for speaking with us. Let's go now live to Canada's Prime Minister.
We're working together to support international efforts to develop a vaccine, expand treatment, expand testing, and ensure that critical medical supplies get to the front lines. As I've said before, this is a global crisis, and it demands a global response. While we're doing everything to keep people safe in our respective countries, we also have to help more vulnerable nations fight this virus by providing more support for their healthcare systems, debt relief, and other forms of assistance. We will keep working together as partners to ensure the safety and health of people around the world. Au cours des dernières semaines, notre gouvernement a présenté
our government has introduced a series of measures to help people get through these difficult times because of the pandemic. With the emergency wage subsidy, we are allowing more people to continue to receive a wage, even if the company they work for has had to slow down or completely shut down its activities. With the Canada Emergency Response Benefit, we are giving $2,000 a month to people who are unable to earn a living because of the virus. And yesterday, we announced that we would be relaxing the eligibility criteria to allow more people to receive the help that they need. If you're a seasonal worker, or if you earn less than $1,000 per month, or you recently exhausted your employment insurance benefits, the emergency response benefit will be there for you. At the same time, we are working with the provinces and territories to top up the wages of essential workers who earn less than $2,500 a month. Caregivers and nursing assistants and others who are working hard to maintain a semblance of normality and who are doing an extraordinary work can be helped. They deserve not only our recognition and our gratitude, but our support. Tonight, I will be discussing that with my colleagues from the provinces and territories at our weekly meeting. And we will also be talking about how we can better protect our seniors who are in seniors' residences or in long-term care facilities. Last night, the Minister of Public Health and Public Safety, Bill Blair, received an official request from the Government of Quebec to lend a hand to healthcare workers. We are working closely with Quebec to finalize an assistance plan, and we will have more news to share with you soon. But I can tell you now that we will be giving them every possible form of assistance, including the Canadian Red Cross, the armed forces, and specialized volunteers who have registered with Health Canada. We will always be there for Canadians in difficulty. Another issue that often comes up at our weekly meetings with the premiers is the supply of medical equipment. I can confirm this morning that the government has finalized contracts with a number of Canadian businesses, including Geometric Energy Corporation of Calgary, which will be providing millions of gloves to our healthcare workers. And later today, Minister Anand will provide an update with respect to recent developments when it comes to supplies.
Over the past few weeks, we've rolled out a series of measures to get people the help they need as quickly as possible. As things evolve, we're hearing from Canadians who need more help, from businesses who need more support. No one should feel as if they're alone in this fight. Our government is here to help you through these challenging times. So when we hear the program is not reaching as many people as it should, we make changes. A few weeks ago, we launched the Canada Emergency Business Account to help small businesses struggling with cash flow. Under this program, banks are offering $40,000 loans, which are guaranteed by the government. To date, more than 195,000 loans have been approved. We're talking about more than $7.5 billion in credit to small and medium-sized businesses. It's a start, but Minister Ng and others have heard from business owners who could really use this help, but who do not fit the current admissibility criteria. So we're going to make some adjustments because we want to be there to support you. Today, we are expanding the Canada Emergency Business Account by both increasing and decreasing the eligibility threshold. Now, businesses who spend between $20,000, who spent between $20,000 and $1.5 million in total payroll in 2019 will be eligible to receive a loan through the CEBA. That's businesses who spent between $20,000 and $1.5 million in total payroll in 2019 who will now be eligible. This is money entrepreneurs and employers can use to cover operational costs and help with other immediate needs. Businesses and commercial property owners are also facing specific challenges because of COVID-19, so we plan on introducing the Canada Emergency Commercial Rent Assistance. This program will provide support to help small businesses with their rent for the months of April, May, and June. To implement this program, we have to work with the provinces and territories as they govern rental relationships, and we hope to have more details to share very soon.
A few weeks ago, we introduced the Emergency Business Account. Under this program, the banks can offer guaranteed loans of $40,000 to eligible companies to help them with their cash flow. Up until now, more than 195,000 loans have been approved. We're talking about more than $7.5 billion in credit for small and medium-sized companies. That is a start, but Minister Ng and others have been talking to a number of employers who need that financial assistance but are not currently eligible to the for the program. So today, we are expanding the business account by increasing and lowering the eligibility thresholds. Now, companies that have spent between $20,000 and $1.5 million in payroll in 2019 can apply to receive a guaranteed loan. This is funding that entrepreneurs and employers will be able to use to meet their cash flow requirements and pay other expenses. Furthermore, businesses and commercial building owners are facing particular problems because of COVID-19. Our government has therefore decided to introduce the Canada Emergency Commercial Rent Assistance. This measure will provide support for small businesses to help them pay their rent in the months of April, May, and June. To implement that program, we will have to cooperate with the provinces and territories because they are responsible for everything relating to rent, and we hope to have more details to share soon.
Had to get used to this new normal. It's been snowing in some places this week, including here in Ottawa, because that's just what 2020 brings. But we hope that the weather will get nicer. As time goes on, staying home and not seeing friends is going to be even more difficult. We're going to miss our colleagues, our friends, our neighbors, and our parents even more than we do now. But we have to be disciplined. We must stay the course. We cannot let the progress we've made go to waste. And above all, we cannot put lives at risk. So let's keep following public health recommendations. Wash your hands. Stay home as much as possible. And if you do go out, be sure to stay at least 2 meters away from others. If we persist and persevere, I know that we will prevail. Once again, thank you all for joining us. I'm now happy to take questions.
Thank you, Prime Minister. We'll now go to the phone lines for some questions. Just one question, one follow-up. Operator.
Thank you. Merci. The first question, la première question, l'inaudible, la presse canadienne. À vous.
Good morning, Mr. Trudeau. With respect to the request from Quebec for assistance, you talked about the Army and the Red Cross. Now, have you made a commitment to send the military in, to send in the Red Cross to help Quebec? Well, Quebec has already given us 2 requests for assistance that we were able to respond to immediately with the Rangers in Inuvik and the Lower North Shore. Yesterday, we received a 3rd request for help, which we're looking at because it's a bit different from what is normally asked of the CAF. So right now, we're looking at this and trying to see how we can help Quebec during these difficult times. And of course, I realize that people are worried for the health of their parents and other seniors who are in these seniors' homes and other facilities. And we know that we have to find other ways to help, and we will be there to help. But we will need to discuss this with Quebec to see exactly how we can support them and respond to this request, which is not the usual type of request. Of course, this is not a usual situation either. Are you saying it's not usual because we're talking about help in long-term care facilities? Yes. Partly it is for medical help or people with medical training. And of course, we do have doctors in the Canadian Armed Forces, but not that many. So we're looking at how we can help. And these are discussions that are ongoing. Of course, when there's flooding, the armed forces are there to help out, and they've been trained to provide support in that kind of situation. Now, this is a new situation, so we are talking to Quebec about this to try and figure out how we can support them. But we will be there to help, and we know how important it is.
Merci. Prochaine question. Order.
Thank you. Merci. Prochaine question, Émilie Bergeron, Agence QMI. À vous.
Good morning, Mr. Trudeau. Could you be more specific about the request from Quebec? Are we talking about help in long-term care facilities? Well, this is a request for assistance we received yesterday from Quebec, and we are looking at it and working with Quebec to see how we can provide that kind of help in seniors' homes and long-term care facilities. We're reviewing this and seeing what exactly we can do, and we will continue to work with Quebec to provide that support. We know how important it is, and we will be there to help. Okay. And my follow-up question? What is going to happen on Monday? The House of Commons is scheduled to start up again on Monday. If there is no agreement with the Conservatives, what exactly is going to happen? Well, obviously, there's nothing to worry about. We have a healthy democracy, and our institutions have to continue to work, not in spite of the crisis, but because of the crisis. So we are currently discussing the situation with the opposition parties to try and find a way to continue to do the important work that is done by our institutions. And at the same time, we are following the recommendations and advice of our public health authorities. So we are going to be concluding those discussions very soon, and I expect to be able to provide details as to how the House of Commons will operate in the coming weeks very soon.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, good morning, Prime Minister. I'm wondering, when you're meeting with the premiers today, are you going to discuss how to phase and reopen the economy? I'm wondering if you're at all concerned that the possibility that some provinces that are doing better may reopen before other provinces, creating a strain there.
I think one of the things we've seen across the country from leaders and from citizens is a desire to know when this is going to be over, how soon we're going to be able to start getting back to normal life. But I think everyone understands that until we have a vaccine, until we are in a place where there is proper treatment, there is a massive amount of testing, we are not going to be able to talk about getting back to normal. We will, hopefully, in the coming time, be able to loosen certain restrictions, but our health professionals and experts and all leaders understand that that has to be done at the right moment and very, very carefully. It would be absolutely disastrous for us to open up too early or too quickly and have another wave hit us that could be just as bad as this one, and find ourselves in a situation of having to go back into quarantine the way we are right now, and have everything that we've done these past weeks be for nothing. We know that there are lots of conversations to be had about how we reopen our economy, what happens in the right order, what the sequencing is, how we keep people safe. But we're a long way from having the ability to start doing that. Of course, conversations are ongoing now, but we're still many weeks away from talking about actually doing anything to reopen our economy, even with the variations across the country of the local state of the pandemic.
Follow-up, Brian?
Yeah, and then in terms of that discussion, do you envision that it will be based on metrics? Will it be based on the number of new cases, say, or some sort of metrics-based approach to making that decision, I guess?
I think looking at where we are on the curve, the number of new cases, the decline in cases will be an important piece of it. But I think what's even more important is the measures that we will have in place to be vigilant, to respond if and when there are resurgences of the virus in local pockets, in particular areas. We're going to need to be extremely vigilant, extremely prepared to respond quickly with massive testing, with contact tracing, with measures that people will be able to kick in very quickly if that comes. I don't think we can talk about reopening things until we are confident that we have exactly the plan on responding to future resurgences in place, and that's a lot of what the conversations are going on right now.
Thank you. Next question, operator.
Thank you. Merci. Next question, David Engren, Reuters. Line open.
Yeah, good morning, Prime Minister. On your G7 call, what, if anything, did other leaders say to President Trump about his decision to suspend funding for the World Health Organization?
I think we all recognize on the call how important it is to continue to coordinate and collaborate the science around the pandemic, to work on public health measures around the world, to share information around vaccine development, around treatments that can work. There is a need for international coordination, and the WHO is an important part of that collaboration and coordination. We recognize that there have been questions asked, but at the same time, it is really important that we stay coordinated as we move through this. That's certainly what Canada is going to do.
And secondly, President Trump yesterday suggested that the border with Canada, the restrictions could be loosened. Are there any such plans from your point of view?
I think there was a recognition by the president, as I've highlighted many times, that the closeness, the collaboration, the friendship between Canada and the United States is quite unlike any other. And therefore, the work that we continue to do to keep our citizens safe while coordinating very carefully is unlike our approaches with other countries around the world. There's a recognition that as we move forward, there will be special thought given to this relationship. But at the same time, we know that there is a significant amount of time still before we can talk about loosening such restrictions. Okay. Nous reconnaissons que
we recognize that Canada and the United States have a friendship that is unlike any other in the world, and we have been working together and continue to work together in a more integrated fashion than any other country. That is what the President pointed out, and I've often pointed it out myself. And we will continue to cooperate and coordinate our efforts. But the reality is that there are still many weeks to come before we can talk about relaxing the current restrictions at our borders or when it comes to physical distancing.
Prime Minister Molly Thomas, CTV National News. You said there would be a significant amount of time, I guess, to having this border discussion. What is the danger to Canada to opening that border?
We are having ongoing discussions on border issues, on supply chains with the United States all the time. We have a integrated economic relationship and a close people-to-people friendship within our countries that allowed us to move forward on closing the borders in a way that assured essential services and supplies continue to travel. We will continue to look at ways we can move forward to help each other deal with this pandemic. We recognize that it will be time still before we can loosen those border restrictions.
What is the danger, though, Prime Minister?
We recognize that there is a need to protect our citizens, as every country is doing. Most countries around the world move forward on restricting travel, and Canada and the United States are no exception.
Are you, sorry, in French?
Okay.
There are many countries around the world that have limited travel and are controlling their borders and only allowing essential goods to come in, and that's exactly what we will continue to do.
About retaliation at all from the Americans if we don't open on the timeline that they might want?
The coordination and collaboration between Canada and the United States on this issue and on all issues has been entirely exemplary. The reflection that the President shared was one of how close we are and how the status of the Canada-U.S. relationship is different than the status of relationships that we have with other countries around the world. There was a recognition that we will do things perhaps differently than other countries, but there is still a recognition that we need to continue holding that the measures that we have in place for a good while to come still.
Prime Minister Janet Silver, Global News. With people dying at group homes for disabilities and Premier Ford saying that the situation in long-term care homes should be, quote, a wake-up call for the world, what is your government planning to do to support the country's most vulnerable citizens, not only now, but in the weeks to come?
Well, tonight, I will be speaking with the premiers, and we will be talking directly about how to ensure better protection for our elders in long-term care. It is impossible to imagine the anguish families and indeed our elders are going through in this situation. There is just so much fear, so much uncertainty. We need to do a better job of being there for them. The federal government is looking at ways to support the provinces as they deal with this issue. We're discussing pay top-ups for people who work in those situations because the conditions are getting more and more difficult. There are also more regulations we can talk about bringing in to do a better job of protecting our most vulnerable. I think that's what Canadians expect. Okay.
This evening, we will be talking about the need to protect our seniors. We recognize that they have particular vulnerability in seniors' homes. And we know that this is a terrible thing that they're experiencing right now, their fear, their isolation, the uncertainty. So we will and we must be there for each other. And our conversation this evening with the premiers will be about how the federal government can support the provinces in meeting that challenge, how we can support the workers in those facilities, and better support our seniors directly.
A little earlier with regards to Quebec's request for military assistance. I'm just wondering, have you received a request from other premiers specifically relating to the military for help for long-term care facilities? And what sort of role do you see the military playing when it comes to long-term care facilities?
We have received 3 requests in total from Quebec, 2 for Canadian Rangers to help out in northern remote areas, both in Nunavik and in Bas-Saint-Laurent. This most recent request around help in long-term care facilities is somewhat different than the kinds of requests that the federal government usually gets around support for provinces, which is much more often around things like floods and forest fires. But we are, of course, working to help. We're working with Quebec to figure out how we can best help in this situation, because this is a situation that is unprecedented at many, many levels. And what we have continued to say is we will figure out how to help. We will be there for each other.
Good morning, Prime Minister Salima Shivji, CBC News. It's April 16th today, and that was the day that your federal modeling said that there would be between 500 and 700 deaths in Canada and more than 31,000 infected confirmed cases. We're at nearly double the number of deaths. So I'd like to know what went wrong with the modeling and what does this mean for Canadians?
I think people need to understand that modeling is a framework that allows us to plan for different scenarios in the future. It is not a declaration of what is going to happen, but it is a discussion of what might happen in the coming days, in the coming weeks, and allows us to plan and prepare for it. I think one of the things we've seen over the past number of weeks is a far more severe impact on seniors' residences and long-term care centres than we had certainly hoped for, or more than we feared, and therefore we need to take more measures to protect our seniors. That's what I'll be talking with the premiers about tonight. Okay. Les modèles nous.
The modeling does not predict and does not say exactly what is going to happen. It allows us to prepare for various scenarios that could occur. And I think that what we've seen in recent weeks is that our seniors' residences have been hit harder than what we were expecting. And that is why we will be addressing that issue this evening with the premiers of the provinces and territories.
Canadian government prepared for some frontline workers, medical workers, to die in the fight against COVID-19? And what would the government possibly be looking at to support family members and dependents left behind?
There have been far too many deaths already in Canada, and that's why we need to continue to do everything we can to slow the spread of this disease and to protect our frontline workers with PPE that we're ordering in, with support for them, for their families, as we get through this difficult time. And the most important thing is for Canadians to continue to stay home, to slow the spread of this virus, to ensure that those who go to work every day to keep the rest of us safe and to fight this virus are able to do so in safety for themselves and for their loved ones. We will continue to do everything we can to protect these heroes.
Bonjour, Monsieur Trudeau, Philippe Vincent Foisy de Radio-Canada.
Radio-Canada, I understand that you're in negotiations with Quebec. We understood that point, but in concrete terms, how many individuals or how many physicians or nurses can you send? I'd just like to have an actual idea of what could be offered to Quebec. Well, as I said, this is an unusual request that we have never received before, so we're looking at scenarios and different ways of helping. We will be there to help. We want to help. But what it looks like at this point, well, that's what we're talking about now. So you don't have any idea that it will be 50 doctors or no. We're discussing that right now as to how we can help. But we also know this is a very serious situation if Quebec is asking the federal government for help. So we will be there to support them, but we have to develop the solution together. When? Well, in the coming hours and days, we are having those discussions, and we know that it's urgent. So we will do this as quickly as possible so that we can send them the support they need. Thank you very much, everyone.
Okay, and that is the Prime Minister of Canada giving us his daily briefing in terms of his government's response to the pandemic, to COVID-19. Lots of news in there. Let me start by saying that probably the most, one of the more significant bits of news is that Quebec has now made a third request to the federal government for support, this one directly to public safety. As you heard there at the end, not really sure what that is going to mean, but it is a third request from the province to get some additional support, particularly because of the outbreak of the virus inside long-term care centres. Let me bring in my colleagues, Vashi Capellas and the CBC's Catherine Cullen as well, to go through a substantive bit of news, I think, there in terms of the expansion of the loan, the G7 leaders' call, and other things. So, Vashi, do you want to start on the loan, maybe, because
Sure.
it did expand things quite a bit.
Yeah, as I had mentioned, Rosie, the loan requirements, it's $40,000 for 1 year, up to $10,000 forgivable if you pay it by a certain date, and it's interest-free, rather, I should say, for that first year. The requirements were that you had a payroll between $50,000 and $1 million. That has now been expanded to go between $20,000 and $1.5 million. So that will, the aim, it sounds like, encompass particularly more of those smaller businesses, sole proprietorships, things like that. It doesn't sound like, for example, it would now encompass people who pay themselves with dividends, so we'll be inquiring about that. But it does expand the criteria of eligibility and therefore, perhaps make it available to more people. The Prime Minister also said there had been a total of 195,000 loans approved, $7.5 billion worth of credit just so far. That describes to me the need for that money right now by business owners. He also announced something, and this is, I do want to make sure we highlight this, the creation of the Canada Emergency Commercial Rent Assistance Program. This would be big news for anybody who is concerned about paying rent. I know on both ends about paying rent and then receiving it in order to pay your mortgage. For property owners, we hear from people like that nonstop. And the details, of course, will be most important here. The Prime Minister says because of provincial jurisdiction over rent, there needs to be cooperation from the provinces. There needs to be conversation with the provinces. My understanding is that hasn't started yet, or just if it has, it's very preliminary. So I think a timeline on that, exactly how the program would work, what it would be worth. I mean, I know many business owners are very anxious about that, but the fact that the federal government is intervening to any degree where commercial rent is concerned, that is a very provincial issue, I think could be very significant for business owners, and certainly signals that they have received the same kinds of calls and emails that we have, which is that so many business owners are struggling to pay that rent, and they are worried about being evicted, or the property owners are worried about being able to pay their mortgage. So that kind of relief will be something very important to watch.
Yeah, and the federal government, in the case of the other business loan, as you pointed out, they're guarantors essentially for the loan. So maybe that's a role that they could play for the provinces who don't have the same fiscal capacity. I'm throwing that out there as maybe what is on the table in terms of options. It does, though, as you say, in the case of the first loan, we know the interest-free and you might get some of it back. But if you are going to use a commercial rent loan for 3 months and your rent is substantive, I mean, it does mean that businesses will be able to reopen, but it also means that there's a potential they reopen with some significant debt. And I guess that's probably a big concern for smaller businesses as well, how long they can carry that debt. But I think it speaks to the fact that the government wants to keep industries and businesses alive, I think.
Yeah, completely. I think the debt accrual is a big thing that we have heard as well, right? It helps them in the interim, but you heard the Prime Minister fielding questions about even the restart of the economy and how incremental and iterative that's going to be. It's not going to be like turning a key. It's not like you're probably in a month going to be able to walk into a restaurant and sit the same way we did 6 months ago, which means that if they do accrue a ton more debt, while it's good that there's no interest on that for a year, the idea of paying it back might not be even in normal circumstances that easy. In these extraordinary circumstances becomes an even more difficult situation. And we've seen restaurants, we've seen businesses, we've spoken with them on CBC News Network often who've already had to make this decision to close their doors. So time is of the essence.
Okay, and Catherine, I'll turn to you. I don't know where you want to weigh in, maybe on the Quebec request, because that is unusual and it doesn't even sound like we know particularly what it will be.
Yes, and I think the context of all of this is incredibly important. I think people across the country have certainly gotten a sense of how dire the situation has been in Quebec long-term care facilities. Obviously, it's a problem outside of Quebec, but particularly in Quebec, we've heard those harrowing stories. Recently, the Premier of Quebec has asked for 2,000 doctors. He made a public plea appealing to people's sense of duty that doctors, but also people with medical training, that he needs them to come help in Quebec's long-term care facility network. A great number of people who work in those facilities have fallen ill with COVID-19. I believe the number the Premier gave was in excess of 1,200 people. And so the Premier was asking for 2,000 doctors to replace them. Now, obviously, some of those people are going to come from within the province. We see after a bit of a war of words, I guess we can say, with the Medical Specialists Federation in Quebec. It does now appear that in excess of 1,000 medical specialists are willing to step up and help, but obviously the province reaching out to the federal government as well. And you heard the Prime Minister saying they want to help, but this is not a request like requests they have had in the past. It is not a request like they are getting in northern Quebec. It is not like a flooding situation. So the question becomes, how many people can they provide? Are these just doctors and medical specialists? What exactly is the work like? I think something, obviously, we're all going to be following closely to see where this goes and what that work would look like, because obviously Quebec is in dire straits. And it feeds into another thing that the Prime Minister talked about, that he was asked about by our colleague Seba Loan, which is this question of the broader picture of what is happening in Canada right now. Of course, the modeling, as Seba said, as you mentioned earlier in the show, I believe as well, Rosie, in terms of the modeling that the government put out, they said, based on their best calculations, between 500 and 700 deaths as of today. We are in excess of 1,000. So the question asked to the Prime Minister, why and what does that mean? He didn't really engage with what it meant for their projections going forward. He reminded us, as we've heard many times, that projections aren't crystal balls. I think at this point Canadians are clear on that. But he did talk about that long-term care piece as being a big part of why we're seeing those numbers higher than we expected. Situation, he said, worse than certainly we had hoped or feared.
Okay, thank you both for that. I will come back to you. I will just also point out that he was asked about the WHO, because he did have that G7 leaders call before coming out to speak to reporters, and he said that everyone recognized the need for international coordination. He recognized, though, and this is probably the furthest I've heard him go on this front, that there are questions being asked, and by that he means the questions being asked in terms of the information the WHO was getting from China. That seemed a slight shift, a recognition that those questions are being asked. But not something it sounds like Canada wants to get involved in right now, that there is still a leadership role for the WHO. And I'll finally just end on this, and this is the issue of Parliament. Parliament is set to return on Monday if they cannot reach an all-party agreement to suspend or find a different way to sit. Those conversations are ongoing, so we will see what they come up with. Certainly the Conservatives pushing very hard to have a couple of smaller versions of in-house sittings, in-person sittings, because they really feel that there's lots of accountability questions there for the government. All right, let me bring in Dr. Samir Sinha. He is the Director of Geriatrics at Mount Sinai Health System and University Health Network Hospitals in Toronto. We've spoken to him before. Good to see you again, Doctor.
Good seeing you, Rosie.
So maybe I'll just start with what Catherine was talking about this Quebec request. What does that tell you about the situation in long-term care centres in Quebec, that they are now requesting some sort of additional support from the federal government, be it the military, the Canadian Red Cross, or others?
It really just speaks to the fact that right now in our long-term care homes across the country, there are many homes that are in crisis. We have homes in Toronto, for example, that are saying that that only 20% of their staff are reporting to work, and that might be because many have fallen ill or for other staffing reasons. And so when you just don't have the staff there, but you still have the residents who need care, they need to be fed, they need to be bathed, they need to be dressed. There's things that need to be done. That doesn't stop here. And so I'm not sure kind of why the call out there, or I can't really speak to the specifics or whatever happening, because I know that on Thursday last week, when the Minister of Health and the Premier came out and announced that there were 813 homes in Quebec out of their 2,000 that were in outbreak. At that point, they said they were going to deploy staff from hospitals, nurses and doctors. So I'm not sure where the gap is, but that's certainly something that the Premier in Ontario announced yesterday, that he's asking hospitals to pitch in, because we're starting to see some of the same issues happen in Ontario as well.
So this would be pitching in a different capacity, in any way that you could help, even if you were a specialist. That's been the plea in Quebec. You're not doing your specializations right now because those things have all been canceled. Just to pitch in any way. What is needed in Ontario? Because I know you know that situation better. In terms of additional support, do you already see doctors being moved around in that way, or even into long-term care centres?
Yeah, we have some homes, for example, that need medical skills, right? They need a doctor to help do prescriptions or to order medications or to help diagnose and determine what's actually happening. Because if a home's doctor goes sick, for example, then someone needs to be providing the medical care. But the real lack or the real shortage that we're seeing right now, Rosie, is that, it's just the nurses, the personal support workers who do a lot of the hands-on care. And so frankly, yes, I'm a geriatrician, I'm a highly specialized doctor, but there's nothing beneath me in terms of if a patient needs to get or a resident needs to get fed, if someone needs to be dressed, these are all things that we should be able to do. And frankly, I think right now the desperate pleas you're hearing are, we'll take anybody. We don't care if you're a brain surgeon or if you're a nurse or whatever you are. These people need to be fed, they need to be clothed, they need to be supported, they need to have care. And I think this is where we're just saying anybody who can do that, we'll take that.
I was talking to a woman named Jacqueline earlier about her mom, Lena, who's in the Eatonville Center where there's been this outbreak. And her mom is 94 and she's sharing a room with someone, and she got tested yesterday. But she's in the dark. She understands staff can't do everything, but she said it was a hopeless situation. That's how she described it. I mean, what do you say to someone like that who is really very frightened about the situation her mom is in?
My heart goes out, because families, most importantly, you've got residents who may not be getting care. You've got families who are worried about, is my loved one going to be, are they going to get the care they actually need? Yeah. And so right now we need to do better. I don't understand why there are discrepancies between thousands of doctors and nurses volunteering and going to these portals and saying, I'm here and I'm ready. And yet we have, desperate pleas for help. I don't know what the disconnects are, but all I can say is, for daughters like that out there who are worried, we need to do better, and we need to figure out, why do we not have these people volunteering to help, helping out? What are the gaps there, and what do we need to do to resolve these issues quickly?
Dr. Sina, if anything, this pandemic has exposed a lot of faults in systems. That's sort of what these things end up doing. But one of the biggest faults it's exposed to me, and I'm sure to other Canadians, is the way we are treating older people in this country. And I'm sure it's something you have been seized with for some time. But what would you hope could come out of this? Because this can't continue. This is a pandemic that is exposing the problems. But what would you hope could be improved as a result of this?
What concerns me is that a number of my nursing colleagues, I wasn't here in Toronto back in 2003 and 4 when we had the SARS outbreak, but a lot of the recommendations about staffing, about having ample supplies of PPE, these were all things that were actually recommended back in 2004. And people are now saying, even the former Ontario Health Minister came out on Twitter last night, Tony Clement, and he simply said, why weren't these things done, so many years later, right? And he's the same political stripe as the current government in power. So, he asked good questions. And it concerns me that for some reason, when all was settled after SARS, we said, yeah, we hear those, but for some reason, we didn't compel ourselves to do that. And maybe it's because we are a society that doesn't value the old as much as we should. Maybe it's a society that doesn't value this sector of care as much as we value hospitals and other parts that may be more apparent to us. But I'm hoping that every Canadian out there, realizes that one day this could be us receiving care in these centers. It probably is a relative of ours right now who's in these homes. There's 400,000 Canadians. I hope that we have a sense of urgency that we need to fix these things now, but we also are left after all of this with a sense that we should not let ever happen again what we've been seeing, that once this horror show is over, we can prevent it from happening again by taking decisive action and hoping, for whatever reason, we didn't do it after SARS, but maybe because it wasn't this deadly as COVID-19 has been, but maybe there's been enough deaths already that everybody realizes that what we've been doing was not working and wasn't acceptable, and it now needs to change.
I'll end on this, that one of the things that they are going to discuss on the Premier's call with the Prime Minister later today, I only have about a minute, Doctor, is a way to boost the salaries and wages for some of these personal support workers. That just seems like an obvious thing to do. Does it not, that these people should also be valued for this critical work that they are doing?
Easy, yeah, 100%. And why a colleague who's doing equally hard work in the community is getting paid less or getting less access to full-time work with benefits, it boggles my mind. But if we value them and we value our futures, we'll do this.
All right, Dr. Samir Sina, always good to speak with you. I do appreciate you making the time as always. Thank you very much.
Thanks, Rosie.
Stay well. All right, as we stand by and wait for the federal briefing with cabinet ministers and federal public health officials, the government has now expanded that small business loan substantially, and it announced the creation of a commercial rent loan that will also be negotiated with the provinces in the coming days. All right, we will leave it there on CBC Main Network. If you want to continue watching CBC News Network and CBC.ca around the world, I'm Rosemary Barton. Thank you for watching. Hello again, I'm Rosemary Barton here in Ottawa. Welcome again to our CBC News special coverage of the pandemic. We are live on CBC News Network, streaming wherever you are on the CBC News app and CBCNews.ca. More help is on the way from Ottawa for small business owners. The Prime Minister just announced an expansion of the Canada Emergency Business Account to help more companies, smaller companies, cope with the economic shock from the pandemic. He also says the federal government is set to help with commercial rent payments. Justin Trudeau also spoke about the border restrictions with the United States after some comments from President Trump last night. He says, our Prime Minister says Canada will not be lifting those conditions for a significant amount of time, in spite of what the President said. That agreement with the United States, though, set to expire at the beginning of next week. All right, let me bring in my colleagues, the host of Power and Politics, Vashi Kapelas, and the CBC's Catherine Cullen. Vashi, maybe I'll start off on the issue of Donald Trump, not only on this issue of the border, where the president yesterday seemed to suggest that this would be one of the places that would open the fastest. He didn't say it was going to happen imminently, but that agreement is set to expire. I think it's next Tuesday, Monday or Tuesday. So I imagine that caused some concern for our government. And then this G7 call, where again, nations, it seems like, had to sort of, try and convince the president to maybe not get on side with the WHO, but to put the concerns sort of on the shelf for now.
Yeah, and it'll be interesting to see, Rosie, if that conversation materializes in anything formal from the president. For example,
Sure.
he said 2 days ago, we're withholding funding. Is there a softening of that at all based on the conversation we know? For example, as Catherine mentioned, there are reports that German Chancellor Angela Merkel put forth the case for the WHO. We heard the Prime Minister, when he was asked about it, talk about the importance of international cooperation and coordination and how he feels the WHO is an important part of that, though he did acknowledge that there are questions about its behavior, its reliance on data and information coming out of China. I think it will be interesting to see if that does have an effect on the president's stance at all, though he came out pretty forcefully again last night. I was sitting in the chair here while the president said that about the border, and my jaw even dropped a little bit. He was asked specifically about the border that we share and about relaxing restrictions. He talked about the relationship between Canada and the United States. He complimented Canada on how it was handling the spread of COVID-19 here. He said that his country was also doing a good job. Of course, there are questions around that as well, specifically in some of the states I would point to that border our country, Michigan and New York City, tens of thousands of cases, New York State rather, tens of thousands of cases in each of those states. And then he said that he was expecting it to be one of the borders with a, quote, early release. He did not attach a specific timeline to that. The Prime Minister was asked about that. Does he share the view? And as you pointed out, he said that those restrictions would not be relaxed for a significant amount of time, that the conversation even about relaxing those restrictions wouldn't occur for a number of weeks, though he tried to, I think, acknowledge the sentiment behind the president's comments by saying that it reflected sort of the closeness of the relationship and the interdependence of the two countries. I didn't necessarily get the same impression when the president was talking yesterday. I mean, he seemed to indicate, and I think what I understood was this is one of the borders of less concern. This is something of less concern to him
Sure.
than other issues in the country. So he would be open to an early release of the restrictions. It's clear that this government is not exactly on the same wavelength there.
Okay, Vashi, thank you for that. Catherine, stand by as well. I'm going to take you now to the federal briefing with the Deputy Prime Minister, Chrystia Freeland, here in the nation's capital.
Canadians have been doing a really good job at physical distancing, and that is saving lives. I know that it's very hard, but together we need to continue. We can't stop now. We cannot squander the gains that we have made so far. And all of us need only look at other countries where we see staggering casualties, horrific scenes at hospitals, to really understand how important it is for us as a country to stay disciplined. C'est un marathon et nous ne l'avons pas terminé.
This is a marathon and it's not over yet.
Nous faisons du bon travail quant à la distanciation
We are
physique.
doing good work with physical distancing, which is saving lives.
Nous devons continuer.
We must continue to do so. We cannot relax our vigilance now.
Nous n'avons qu'à regarder les régions du monde.
We have but to look to other regions of the world, whether they are near or far, where losses are staggering.
We are going to hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, the Dr. Howard New, the Minister of Public Services and Procurement, Anita Anand, by video link, the Minister of Finance, Bill Morneau. Also by video link, the Minister of Small Business, Export Promotion and International Trade, Mary Ng, et le Président du Conseil du Trésor,
and the President of the Treasury Board, Jean-Yves Duclos. Dr.
Hello everyone, bonjour à toutes et à tous. I'll begin with our usual update on the number of COVID-19 cases in Canada. There are now 29,826 cases, including 1,048 deaths. Close to 50% of the deaths are linked to long-term care homes, and 93% are in people over 60 years of age. For the lab testing, we've completed tests now for over 487,000 people, with 6% confirmed positive, as Canada continues to improve our testing to better track where the disease is spreading. As I said yesterday, there are signs that our collective efforts, starting several weeks back, have had an effect to slow down the epidemic. Assuming our staycation for the nation over the long weekend has helped to maintain this trend, we now need to double down to stamp out outbreaks in high-risk settings. If the measure of a society is in how it cares for its most vulnerable, this pandemic has revealed the chink in our armor. Long-term care homes and seniors' residences have been severely impacted, but there are other vulnerable groups that urgently need our attention, including people who are experiencing homelessness and precarious housing. Not having a home is a significant barrier to following public health advice, like maintaining physical distancing and hand hygiene. As well, it is important that resources and supports for infection prevention control are in place to protect staff, clients, and guests in shelters. Without immediate action, there will be more outbreaks and avoidable deaths with broader societal and public health implications. Some municipalities have taken action to secure additional accommodation to ease crowding and facilitate physical distancing. This is a good step forwards. Volunteers are reaching out to support homeless shelters, including making hygiene kits and helping to serve and deliver meals to those in need. We cannot crush this curve unless and until everyone is looked after. Let's come together and do this. Thank you.
Thank you very much, Dr. Tam. Et maintenant, je donne la parole au Dr. Howard New.
I will now give the floor to Dr. Howard Ng.
Merci. Et bonjour.
Thank you. Here is our daily update on the number of COVID-19 cases in Canada. There are now 29,826 cases in the country, including 1,048 deaths. Close to 50% of the deaths are linked to long-term care homes, and 93% of deaths are in people over 60 years of age. For the lab testing, we've completed tests for over 467,000 people, 6% confirmed positive. Canada continues to improve testing to better track where the disease is spreading. As mentioned yesterday, there are signs that our collective efforts, starting several weeks back, have had an effect to slow down the epidemic. Assuming our staycation for the nation over the long weekend has helped to maintain the trend, we now need to double down to stamp out outbreaks in high-risk settings. If the measure of a society is in how it cares for its most vulnerable, this pandemic has revealed a chink in our armor. Long-term care homes and seniors' residences have been severely impacted. But there are other vulnerable groups that urgently need our attention, including people who are experiencing homelessness and precarious housing. Not having a home is a significant barrier to following public health advice like maintaining physical distancing and hand hygiene. It is important that resources and supports for infection prevention and control are in place to protect staff, clients, and guests in shelters. If we don't act immediately, there will be more outbreaks and avoidable deaths with broader societal and public health implications. Some municipalities have taken action to secure additional accommodations to ease crowding and facilitate physical distancing. This is a good step forward. Volunteers are reaching out to support homeless shelters, including by making hygiene kits and helping to serve and deliver meals to those in need. We cannot crush this curve unless and until everyone is looked after. Let's come together and do this. Thank you.
Merci, Dr. Knu. And now we will hear from our Minister of Public Services and Procurement, Anita Anand. Anita, please.
Thank you, Christia. Before I begin, I would like to send a big thank you to Conquer COVID-19 and Haley Wickenheiser, who have been running PPE drives and distributing personal protective equipment. Stepping up for our communities and donating what you have on hand is extremely helpful. It is the Canadian way and complements our government's tireless efforts to purchase vital supplies for our healthcare workers. We are operating in a hyper-competitive global environment, which results in complex and sometimes unpredictable supply chains. But we are making progress, which I will discuss today. Je peux vous dire qu'il s'agit vraiment d'une démarche.
I can tell you that this is truly a Team Canada approach to procurement, with all hands on deck and all levels of government working together. Furthermore, I will be speaking with my counterparts in the provinces and territories again tomorrow.
In a market characterized by high demand, we are buying existing inventory where we can, and placing large orders to create and maintain a steady stream of goods flowing from diverse sources over the coming months. Pour ce qui est de nos achats à l'étranger,
for our international purchases, which are largely coming from China, our officials are working closely with partners on the ground, which includes embassies and logistics experts, to get these supplies into Canada.
In particular, we are working with Bolloré Logistics Canada, based out of Montreal, and with Deloitte Canada to provide help with transportation, receiving, storage services, and customs clearances. CargoJet and Air Canada have stepped up as well to bring home to Canada federal orders as well as provincial and territorial orders. And we continue to work with other officials in China, including our formidable ambassador, Dominic Barton, and diplomatic staff to navigate the current complex supply chain environment. Je tiens à remercier tous ceux et celles qui contribuent.
I want to thank all those involved for getting those vital supplies into the country and into the hands of our doctors, our nurses, and our healthcare professionals when needed and as fast as humanly possible.
In addition to our international buying efforts, Canadian companies have responded en masse to our call out to suppliers at buyandsell.gc.ca. Through this call to action, we have signed contracts with suppliers like Geometric Energy Corporation, based in Calgary. This company will provide millions of nitrile gloves for Canada's healthcare workers. Au cours des dernières semaines, nous avons également entendu
Over the past few weeks, we have also heard about the many Canadian companies that are ramping up production, with some manufacturers completely shifting their production lines.
Thinking of Canadian companies like Bauer in Quebec that have gone from making hockey gear to making face shields for frontline medical workers, or Stanfield's in Nova Scotia that is set to provide us with 100,000 medical gowns per week, to name a few. Je suis très heureuse d'annoncer que
I'm very happy to announce that we can add another name to that growing list.
Le gouvernement du Canada a signé un contrat avec Irving
The Government of Canada has signed a contract with Irving Oil, which has retooled parts of its production line to produce much-needed hand sanitizer. Production will start being delivered over the next few weeks.
The Government of Canada has signed a contract with Irving Oil, which has retooled parts of its production line to produce much-needed hand sanitizer, and Irving will start delivering in the next few weeks. This is part of more than 20 million liters of hand sanitizer that we've ordered, including an order from Fluid Energy in Calgary. These companies and many others serve as great examples of the Canadian ingenuity and tenacity that will see us through this crisis. Je souhaite maintenant vous parler des dernières commandes.
Let me now turn to the latest orders and deliveries we have of the most in-demand supplies on the
We
market.
have chartered 6 flights, and they have arrived in Canada. And we expect approximately 4 more in the next week, carrying a variety of goods from China, including N95 masks. These flights are, of course, in addition to goods that arrive by other means. As of today, we have ordered just under 300 million surgical masks and approximately 145 million N95 respirators. To date, we have received deliveries of more than 17 million surgical masks. And as the Prime Minister said earlier this week, roughly 800,000 N95 masks were delivered to the provinces and territories last week, and we expect 1.1 million to reach them this week. Nous avons aussi commandé plus de 900 millions.
We've also ordered more than 900,000 pairs of gloves, and more than 14 million have arrived in Canada.
Orders of up to 30,000 ventilators with CAE, Starfish, and ventilators for Canadians. All 3 are Canadian companies that will be manufacturing these life-saving machines right here at home. These are only some of the supplies that we have on the way, and a handful of the Canadian companies that are rising to the challenge. We are operating in a hyper-competitive market, and while demand for these supplies is going up, Canada and Canadians are keeping up. Merci beaucoup. Thank you so much.
Thank you, Anita. And now we will hear from our Finance Minister, Bill Morneau. Bill, please.
Well, thanks, Christia. Good afternoon to everyone. As we come together to stop the spread of COVID-19, the government's working hard to support the economy. We're also trying to listen to the needs of Canadians so that we make sure that we get it right. We know that many small businesses are worried about paying the rent, about paying their suppliers, and paying their employees, people who've worked side by side with them for years. Last week, we launched the Canada Emergency Business Account, which is offering interest-free loans of up to $40,000 to small businesses and to not-for-profits. And 25% of that loan is forgivable if it's paid back by the end of 2022. I want to give you an update. To date, more than 195,000 loans have been approved through Canadian financial institutions. But we've also heard that there are many small businesses who need support, but who didn't qualify for these loans. So today, we're announcing that we're expanding the eligibility requirements to allow businesses that have between $20,000 and $1.5 million in annual payroll to apply. So I'd encourage those organizations to reach out to their financial institutions by phone or by email to find out how to actually apply. Aujourd'hui, nous annonçons que nous élargissons les
Today, we're announcing that we are broadening eligibility criteria for the Canada Emergency Business Account in order to allow businesses whose annual payroll is between $20,000 and $1.95 million. Communicate with your financial institutions by phone or by email to find out how you can apply.
We'll be there to help businesses to bridge through to what we expect will be better times. We know that in every corner of our country, small businesses are the heart of our communities. They represent the best of our country, that you can work hard and bring a good idea to fruition and provide for yourself and for your community. We also know that many organizations are worrying about their rent, the rent that's coming due. We know that we're all in this together, and I want to start by commending the landlords who are offering relief to tenants that are facing hardship. We need our businesses to remain strong so that when this is over, they can continue to be good tenants and pillars of our community. In recognition of the challenges that are facing Canadian businesses and commercial property owners, we're announcing our intention to introduce the Canadian Emergency Commercial Rent Assistance Program for small businesses. The program will seek to provide loans, including forgivable loans, to commercial property owners who provide small businesses with rent reductions for April, May, and June. To do this, we're going to need to work in partnership with provincial and territorial governments who govern the commercial property owner-tenant relationships. We'll continue to work with provinces and territories on this proposal to ensure that we can enhance support for hard-hit small businesses, and we will have more to say on this in the very near future.
Businesses and business owners are facing significant challenges. Therefore, we're announcing our intention to introduce an emergency commercial rent program. This program will offer loans to owners who offer small businesses rent rate cuts for May to June. We're working with provinces and territories that regulate the relationships with renters and owners. We're continuing to work on this program to ensure that businesses severely affected by the crisis are supported, and we'll have more to announce soon.
Across Canada, we want you to know that we will continue to listen to you. We'll have your back. We know that this is an extremely difficult time, and we're not going to stop working to find ways to support you and to support your employees. Thanks very much. Thanks, Christia.
Yeah, okay. Thank you very much, Bill. And now, also by video link, we will hear from our Minister of Small Business, Export Promotion and International Trade, Mary Ng. Mary, please.
Thank you so much, Christia. And Bill, thank you. Bonjour tout le monde. I'm glad to be joining all of you by video conference today. There's no question that small businesses and their employees are some of the hardest hit in this crisis. And from the very beginning, we said we were going to listen and we were going to adapt to what you tell us. This is why what we've done and what our government has done will continue until we get to the other side of this. A few weeks ago, as the finance minister said, we launched the Canada Emergency Business Account to help our small businesses who are struggling to keep up with their operating costs and their cash flow. And under that program, small business owners can go to their local bank or credit union to apply for an interest-free $40,000 loan backed by the government. À ce jour, environ
To date, about 195,000 loans have been approved.
That's 195,000 small and medium-sized business owners who are getting the help that they need to keep up with your operating costs, your utility payments, topping up your employee salaries and wages to complement the 75% wage subsidy. Today's announcement to expand the eligibility criteria for this program will mean even more businesses will qualify. It means that your favorite restaurant can keep the lights on while they switch over to delivery service. It means that small furniture store that usually relies on foot traffic to stay afloat can continue to pay the costs of upkeeping their warehouse space. It means that that physiotherapy clinic can top up the wages of their rehired 5 employees to 100%, along with the support of the wage subsidy. It means that the local bed and breakfast can maintain their property while they've had to temporarily close their doors. We've also heard that businesses, we've heard them loud and clear, that they're going to need help paying the rent, and that's one of the significant operational costs and that they have to keep up with, and that's what we intend to do. You've heard from both the Finance Minister and the Prime Minister that we will introduce a Canada Emergency Rent Assistance for small businesses, and this program will provide loans and forgivable loans to commercial property owners who will in turn lower the rent for their small business tenants for the months of April, May, and June. And of course, we will work closely with the provinces and territories on this, given that this falls under their jurisdiction, and we'll have more details to share soon. Il s'agit de sauver des emplois.
This is about saving jobs and keeping businesses going.
This is about saving jobs and keeping businesses going. And I want to assure all small business owners and entrepreneurs out there that we are in your corner. We're listening, and I won't rest, and I know my colleagues feel the same way, until we've done everything possible to support you. Merci beaucoup. Thank you. I'm now going to pass it to my colleague. Thank you very much, Christian.
Okay, thank you very much, Mary. Et maintenant, je donne la parole au président.
I will now give the floor to the President of the Treasury Board, Jean-Yves Duclos. Jean-Yves, please. Thank you, Christian, and hello, everyone. I just want to talk quickly about the situation of seniors in Quebec, especially those who are in long-term care facilities. We are all affected by the situation that many of these seniors are currently in. This is very difficult for many people who are working in those facilities as well. The Prime Minister has indicated again this morning that the Canadian government wishes to improve its ability to support provinces in these extraordinarily difficult circumstances. What's already being done, what we want to continue to do, are efforts by the Canadian Red Cross, which we are supporting, which are important. There's also Health Canada's efforts, which is adding on to the list of volunteers. By improving this list of volunteers, which was already started by Health Canada, we're able to add on more volunteers. There was a request made to Minister Bill Blair to receive help from the Canadian Armed Forces. Discussions are ongoing. Decisions will eventually be made. We also wish to highlight how much we want to support our workers, our frontline workers, in these extremely important locations. That support is absolutely essential. Yesterday, the Prime Minister indicated that the Government of Canada wishes to help provinces, including Quebec, who wish to increase salaries to frontline workers in essential sectors of our society, especially those working where our seniors are located. We know over the long term these are essential services, and we need to correctly support these workers. We want to support them over the long term and the short term. This is significant work that we are all doing together to improve the assistance to Canadians, but Quebecers in particular. Thank you. We are now ready for your questions.
So we'll start with 3 questions on the phone and turn to the room. 1 question, 1 follow-up. Opératrice.
Thank you. Merci. La première question est de Raymond Filion.
The first question is from Raymond Filion, TVA. Yes, thank you. When it comes to the government's support capacity, what resources does the federal government have to meet the needs of Quebec? How many soldiers, how many volunteers are available to meet Quebec's requests? Answer. This is part of the significant discussions that are happening between both governments. It depends on the circumstances in which Canadian forces could be called upon to work in care, especially in long-term care facilities. Everything depends on the conditions that the Government of Quebec would like to offer when it comes to responsibilities and working conditions to members of the Canadian Armed Forces. We know that the Armed Forces have multiple skills. As we were saying, it's important to match those skills and to ensure that we respect the leadership of the provinces. Question: how many resources are being requested by the Government of Quebec? Do you have any numbers? Answer: there are numbers, but we also have working conditions. We are discussing those conditions right now. The government received a letter last night from the Government of Quebec to accelerate those discussions, which includes the number of workers, but more importantly, the type of workers that will be called upon. This is part of the discussions that are ongoing with the Government of Quebec. Thank you. Next question.
Thank you. Merci. The next question is from Laura Osman, the Canadian Press. Please go ahead. La parole est à vous.
Thank you. Minister Anand, I have a question about the supplies for N95s. We're hearing from some doctors who are joining nurses' unions and calling for the use of N95 masks whenever in contact with potential COVID-19 patients to enhance their protection for those on the front line. And they're worried they might not have the supplies to accommodate that. The government is obviously trying to stock up as much as possible, but will frontline workers have enough if demand for N95s increases beyond what we're seeing now?
Thank you for the question. I will say that we have received over, just in the past 2 weeks alone, around 2 million N95 masks that are expected to be delivered to the provinces in total by the end of the week. So that's the first point to directly answer your question on numbers. But I want to give you a picture of the global environment and not sugarcoat it. We are operating in an era of high global demand, and we must watch the supply chain from start to finish until these masks and other PPE find their way directly back to Canada and are in a warehouse for distribution. And so monitoring that supply chain from start to finish on the ground in China, for example, is a key priority of our ministry and our government, and we will not stop until we have the supplies that Canadians need. We have a very solid team on the ground in China. We have been working very closely with Ambassador Barton, but we've also retained private companies, Deloitte Canada and Bolloré Canada, for example. And those companies are assisting in our efforts to ensure that we have a steady supply of masks and other PPE coming into Canada. Again, it's complex, but we are managing it under these very tight global conditions.
Follow up.
Thank you. And perhaps for Minister Freeland, I'm wondering if your intelligence officers provided you with a Canadian-produced assessment of the coronavirus threat at that incident response group meeting in late January. And if so, what were their conclusions at the time?
Laura, I am not at liberty to go into any details of intelligence shared with me and the government and other ministers. But what I can say is that Canadian intelligence analysts and officials are following and have been following from the outset the coronavirus pandemic. This is currently the biggest threat that Canada faces, and it is absolutely appropriate for our intelligence officials and analysts to be following it closely. And that intelligence is shared with the government, with key ministers, and it absolutely has and continues to inform our response.
Thank you, Deputy Prime Minister. Next question on the phone.
Thank you. The next question, la prochaine question, Hélène Buzetti, Le Devoir. Please go ahead. La parole est à vous.
Yes, hello. My question is actually for Dr. Tam. Last week you said that according to Canada's prediction, there would be between 500 and 700 deaths by today. We now have about twice as much. So my question is twofold. A, how do you explain the discrepancy? And B, what does it tell us about the curve we're following? Last week, you presented us with 4 scenarios with 4 rates of infection, 1%, 2.5%, 5%, 10%. And we were under the impression that we were following either the 1 or the 2.5% curve. So given today's numbers, which curve do we now seem to be following?
So those were sort of planning scenarios, first of all. But let's just talk about where the epidemic is at. And we do know, and as I said yesterday, the actual doubling time for the cases, confirmed cases in Canada has been slowing down. That's actually, that's the trend. So that you are seeing that curve bending. The issue in terms of modeling or projecting deaths, that's not even modeling, is that has to change over time. And it reflects, I think, several different phenomena. One is the epidemiology of the outbreak itself. So when the high proportion of cases occurring in long-term care facilities, for example, unfortunately results in higher fatality amongst the people who get the illness. So I think that is the current picture right now. At the beginning of any epidemic, the case fatality will be underestimated. And this is a phenomenon of both the time it takes for someone to undergo the full clinical course of their illness to the final outcome. That's sort of the numerator. The accelerates at a slower rate at the beginning. And then, unfortunately, after a number of weeks, those who have been infected, who are vulnerable and at high risk will, unfortunately, die from the illness. So this is the phenomenon I think that we're seeing. At the same time as if the actual, so that's a numerator, sorry. At the same time as if the denominator is slowing down, when the growth rate is slowing down, at the same time as the number of deaths are going up, that ratio is going to increase. And I think that's what we're seeing right now. And we might expect that ratio to continue to increase as the epidemic slows down, but also then the population now being affected and the higher proportion of death that we expect to see in the older age groups and those with underlying medical conditions. So these projections, I think you were thinking of the short-term forecasts, are very sensitive to our actions, but also to the epidemiology, and that projection has to change really very quickly on a daily basis.
So as a follow-up then, last week we said that the expectation was maybe to have 4,400 deaths. So does that prediction change now given the situation, how the situation has evolved over the last week?
Yes, so the projections are sort of looking at a number of days out. And if you actually look at that projection, the number of cases projected very, very closely to what was predicted for April the 16th. So I think at that time we've projected the number of cases being just over 22,000 to 31,000 cases, and we're now currently tracking in that sort of time, that frame for the numbers of cases. So then is the number of deaths, and as the case fatality, that ratio increases. Again, any number that I sort of present right now will be subjected to change as the ratio changes. So our modelers at the last look are projecting anywhere between 1,200 to 1,620, so 1,620 deaths by April the 21st. So again, any number that I provide you will be subjected to variations as we change those projections over time.
Merci, docteur. On va prendre les questions dans la salle.
Thank you, Doctor. We'll now move to questions in the room.
Hi there, Marika Welsh with the Globe and Mail. I'm wondering, either for Dr. Tam or for Deputy Prime Minister Freeland, if you can explain why the number of warehouses stocking supplies from the National Emergency Strategic Stockpile were reduced, and whether that led to a reduction in the amount of PPE that was also stockpiled by the federal government.
So I think the consolidation of warehouses are a reflection, I think, over time that changes in terms of the distribution of equipment. And that there are, I actually looked at that we now have 6 locations for our NES warehouses. And they were, so supplies, for example, the Regina warehouse, as we noted, was closed. But it reflects how goods or supplies can be transported in different ways now, and more rapid ways compared to decades ago. You now have the environment for shipping and sending supplies is quite different. So that had to change with the times and with the consolidation of the effectiveness of the distribution system itself. And so I think, in terms of PPE. I think over time, I think renewal of the stockpile occurred, as we said, where we were not used to providing expired PPE to others. As we move sort of forwards, given this experience, we have to optimize product life cycle, but also minimize perhaps the disposal of expired stock. Now, they do take up quite a lot of space, but you have to sort of manage that. And, obviously there's sort of a backup, if you like, then perhaps to the non-expired stock, but that's not necessarily a practice that had been done in the past.
Right, that didn't answer my question of whether or not the same level of PPE supplies were maintained despite the closures, but I have another question for either, again, Deputy Prime Minister Freeland or for Dr. Tam. The Canadian government a number of weeks ago gave a nearly $1 million COVID-19 research grant to a researcher at the University of Alberta to work in collaboration with the Wuhan Institute of Virology. The research is to help to develop a form of rapid testing for the virus. The Wuhan Institute of Virology, of course, is from the center of the original outbreak. Can you explain why Canada is funding a collaboration with this institute and what expertise or specialized knowledge the institute can bring to bear on this research?
I don't know if Dr. New knows the answer to this question. We will talk to our colleagues at the Canadian Institute of Health Research or the funding organization and determine that. Obviously, though, in general, understanding the biology of the virus or some characteristics of it is, I'm sure, very useful in determining the type of diagnostics and other work that's needed. And I think, obviously, all hands on deck to try and resolve the issues needed in terms of the science and what kind of testing capability might be needed. So I can't comment on the specific project, but we'll get back to you on that.
Can you answer, though, to my direct question, whether PPE supplies were maintained despite the closure warehouses?
I think we'll get back to you on that. What we've had, as I said, the National emergency strategic stockpile was not really set up to back up the whole of the country's healthcare system. That is the responsibility of provinces and territories and their stockpile. We were more focused on very highly pathogenic and unusual organisms, such as the Ebola virus, with its special kind of personal protective equipment that might be required for that sort of setting, or very, very unusual pathogens that provinces and territories are not able to or don't really have as much of a role in for preparing for those very unusual pathogens.
Van Dusen, CBC. So we know what is going on in seniors' homes is reprehensible, and seniors need help now. So the question would be, I guess, to either Mr. Duclos or to Chrystia Freeland, what specifically is François Legault hoping that soldiers will do? We know that he needs doctors, he said that, but he also said, j'ai besoin de bras, j'ai besoin de tout le monde. He said he needs everything. So would they be serving meals, doing maintenance? If you could be specific, because a lot of people want to know.
We received, as the Prime Minister said, we received late last night a formal request from the province of Quebec for direct aid from the Government of Canada and from the Canadian Armed Forces. We are looking urgently at that and are looking urgently to see what the Government of Canada, what the Canadian Armed Forces, what the Canadian Red Cross can do to help. We agree that this is an absolutely urgent situation. In terms of the precise tasks that Government of Canada personnel could do and the precise numbers, that is something which is being discussed even as we speak. There will be a First Minister's call later today with the Prime Minister and all of the premiers. I will join the Prime Minister on that call and support him. And, you know, I want to emphasize, as Jean-Yves has already said, we are fully seized of the urgency here. We are working very hard to support the province of Quebec, as is the federal government's job. We don't have details to offer at this moment on personnel or tasks because those need to be worked out, but they are being worked out right now.
Okay. I think this question would be also for your Deputy Prime Minister about the possibility of labor shortages in the food supply chain, unless that would be for someone else. But we know that some meat plants have had COVID-19 outbreaks, and just wondering is there any contingency plan to deal with labor shortages should it get worse?
That's an excellent question, Julie, and that is something that our government has been working on, that I've been personally focused on over the past few days. We have been talking with industry leaders. Food processors are an essential part of our food supply chain, and food security is clearly really important in a crisis like this. We are lucky in Canada because we are a major food exporter. I am so grateful to all of our farmers and ranchers and food processors. But you're right that the coronavirus poses particular challenges to food processing facilities because of the dangers of contagion there. And we're working closely with the industry to find ways to be sure we can keep the food supply chain strong and working. And I'll add just one thing, which I heard from a leader in the food processing sector this week, which is Canadian food processors are experts in decontamination. You might say that that is an area of particular necessary focus for that sector. They know how to handle this, and the government appreciates that expertise, and we're working with them to be sure that they can continue to work and that we can continue to have food in our grocery stores and on our tables. And just finally, I really want to thank all the people, all the Canadians who work in the food processing sector. These are really hard jobs. They are really essential jobs. Thank you very much.
We're hearing about a situation at an oil sands camp in northern Alberta. Now, what concerns do you have about COVID spreading at these work camps?
That is another good question. And the work camps are, of course, an area of particular vulnerability. I have had a number of conversations with Premier Kenney from the very outset about very thoughtful measures that both the province and industry are taking to minimize the possible spread of coronavirus in the work camps. And, that is an effort that we need to continue. And where the coronavirus does appear, we need to be very, very swift in containing it. And I will say that the province of Alberta, the provincial public health response has been very strong to date, and I have every confidence it will continue to be.
Okay, thank you. And workers sometimes come from other provinces. So when they leave the work camps, should they be self-quarantining at home? Is there anything in place to make sure they're safe or we're safe until there's a period of time where we're all clear on that?
As you know, Mike, some provinces and territories do have in place self-isolation requirements for anyone coming into the province from outside. The provinces and territories that have put those in place have done it for a very good reason, and they expect, and I expect, all Canadians to follow those very important rules.
For Minister Freeland, Rachel Haynes here from CTV National News. President Donald Trump has talked about easing restrictions on the border with Canada. The Prime Minister said that we are still weeks away. It's too soon to talk about easing any kind of restrictions, but obviously that's being brought up with our neighbor. If the U.S. does reopen its border with Canada, would Canada then be in a position where we would have to follow suit?
So thank you for the question. And I'm happy to share with you and with Canadians that we are, even as we speak, just over the past couple of days, we have been engaged in productive conversations with our American neighbors about the border restrictions. Canada believes that the right thing to do would be to extend those border restrictions. We just discussed the restrictions that exist within our own country on travel between provinces. The neighborly thing to do right now is for all of us to be staying at home and to travel only when it is absolutely essential. So the way we can be good neighbors to our American friends is by maintaining those restrictions. And we are currently having very constructive and productive conversations with our American neighbors about precisely that.
Obviously, Donald Trump, though, does have a reputation of not being so neighborly when it comes to Canada, as we've seen it over the past few years. So if they do decide not to be neighborly and open the border, can you guarantee now that Canada will not open our border to Americans until it is absolutely safe to do so?
I can guarantee one thing, and I can offer some information. What I can guarantee is decisions about Canada's border are taken by Canadians. Full stop. And when it comes to easing border restrictions of all kinds, our government will only do that when it is appropriate and when it is not a risk to the health and safety of Canadians. When it comes to our discussions and our relationship with the United States, during the coronavirus pandemic, and specifically with regard to the border, the relationship has been extremely friendly, extremely neighborly, and extremely effective. We put in place restrictions on non-essential travel at the border in a reciprocal and coordinated way, and those restrictions are working. We have a huge decrease in travel across the border. At the same time, essential travel and essential trade in food, in medical supplies, continues. So the relationship, in fact, is working really, really well. And we are going to keep on working hard to ensure that that continues to be the case.
Thank you, Deputy Prime Minister. We'll now turn back to the phone for 3 additional questions. Operator.
Thank you. Merci. The next question, la prochaine question est de Micheline Laflamme, Radio-Canada. La parole est à vous.
Question. Yes, when it comes to assistance provided to Quebec, the Prime Minister mentioned the Army and the Red Cross and specialized volunteers from Health Canada. Could you tell us how many Quebecers are on this list? And could you indicate how you plan to coordinate the offer to meet Quebec's needs? I'm not sure if you can give us examples of what's already been done. Answer. Excellent question. The work is being done at many levels. There's about 30,000 volunteers that have proposed their services over the last several weeks on Health Canada's website. These volunteers are found throughout the country. They have different skills and different language skills. Work between Health Canada and public health agencies from various provinces, including Quebec, is going well. Information is being shared in order to ensure that the Government of Quebec can use this information in order to solicit the expertise of volunteers who are available. Volunteers don't always need to be physically present in a specific location. Part of the work could be to conduct follow-up of cases of confirmed contagion, which is contact tracing with people who are contagious, to follow up on people that they may have encountered in the last few days and weeks. That's work that can be done remotely. We will, of course, take into account those people's skills as well as their language skills in the case of Quebec. This is going well. There's a great deal of consideration for the fact that it's support for the considerable work that Quebec is doing to mobilize other workers through other methods in Quebec. I think that this collaborative effort is very useful, but also much appreciated.
Micheline, en suivi?
Micheline, your follow-up? Yes, Richard Garceau from the hospital in Moncton indicated that last week that the kits made in China to conduct testing were contaminated. We're talking about 320,000 swabs. Were measures taken to ensure that this doesn't happen again? Is there other medical equipment coming from China that could not be used because it did not meet Health Canada's criteria?
Thank you so much for the question. The issue of quality control of goods coming from outside of Canada, and in this case China, is one that we are watching very closely. On the ground in China, we make sure to have quality control checks there. And then on the ground in Canada, the Public Health Agency of Canada also runs inspections. And where those goods are unusable, we then move to a secondary or tertiary supply chain to ensure that we can fill the gaps that are caused by those contaminations. And so it is a constant place of attention for our government to make sure that the goods that are getting out to all parts of Canada are in acceptable use quality condition, and it is something that we take very seriously from point A to point Z. Having said that, in this particular case, it appears that there was a mishap, and it is something that we are taking very, very close watch over to make sure it doesn't happen in the future. And in terms of the inspections done in Canada, those are done by the Public Health Agency of Canada, and so it would be appropriate for Dr. Tam to add any words here.
Yes, so when it comes to the swabs, this is a a supplier that's already in place, is someone that is a supplier that's already approved by Health Canada. And so swabs can go directly and be distributed to the province and territories. When there's an issue that arises, we support the testing, again, of those swabs. And then moving on to looking at innovative ways to look at whether you can actually sterilize them. So that is the work that we were doing at the National Microbiology Lab, as well as, of course, then looking for replacement swabs through many different channels, including some of the domestic innovative channels as well. So again, we managed this together with the province and territories very rapidly in the last days.
Oui, et je voudrais ajouter seulement que
I would just like to add that when it comes to the swabs, when we discovered that there was a problem with imports from China, we worked very, very quickly over the weekend, over the Easter weekend, especially myself and Minister Anand, and we found other sources of swabs that are now in Canada. They have already arrived. I wish to reassure Canadians we have enough swabs right now. That's very important because swabs are essential to conduct tests.
Merci, Madame la Vice-Première ministre.
Thank you, Deputy Prime Minister. Next question, please.
La prochaine question est de Ryan Timothy. Please go ahead. Your line is now open.
Yeah, this question's for Dr. Tam. You talked obviously before about the metrics that you were tracking and the data that you were seeing. In terms of being able to start to return to normalcy, is there a specific metric that you think will be really key to the country being able to return to more normal life?
I think there's going to be quite a number of them that we'll be watching for. As I said, we have to be very careful not to call the peak early. We'll not see the estimation of whether we've passed the peak until we've actually passed it. So that we have to look for very carefully. And then the
Okay, we're going to pull away from the federal briefing with a reminder that there will be a call between the Prime Minister and Premiers later tonight. We'll also hear from the official opposition leader, Andrew Scheer, at around 3:30. The government has expanded the Canada Emergency Business Loan to include more people, and they've also announced today a new rent loan program for commercial rents. Those are some of the highlights from the federal briefing today. You can catch Vashi Kapelas later at 5 Eastern on her program. I am Rosemary Barton. We will now go to Toronto, where Doug Ford and his officials are giving their daily briefing. We'll bring that to you live.
And for our most vulnerable, for our seniors, our parents, our grandparents, how far we go, how hard we fight will mean the difference between life and death. And we owe it to them. We owe it to those who cannot defend themselves to do everything in our power. Yesterday, we announced our action plan to protect our long-term care homes from COVID-19. These homes are turning into the front lines of this battle. And yesterday, we sent in the cavalry. Medical SWAT teams are being deployed to long-term care homes who need it most. We're bringing in the very, very best specialists who are trained in the detection, prevention, and containment of the world's most deadliest diseases. These people understand better than anyone in our system how viruses like COVID-19 work. And they know how to stop this virus dead in its tracks. I've said it before, the dedication and commitment of our long-term care home staff is incredible, truly incredible. They continue to put the needs of the community ahead of themselves, but they need our support. And I want them to know more help is on the way. I said we would do absolutely everything in our power to fight this virus. And after weeks of preparation and hard work by hospital staff and our frontline heroes, We've added over 2,000 acute care and critical care beds to our hospital system since the start of this outbreak. And we're on track to add another 4,200 acute care beds by the end of April. It's because of these efforts that we're able to redeploy resources to our long-term care homes and other priority areas. And last week, I promised by today, we'd be testing 8,000 people a day. Well, today we're at over 9,000 COVID-19 tests. We've hit our first target, and we're going to keep ramping up our efforts until we hit 14,000 tests a day by the end of this month. We'll continue to expand testing more people and priority groups. We've expanded our testing guidelines. We're making sure we're testing the people who need our support the most. We'll be testing at homeless shelters and women's shelters, homes for people with disabilities. We'll be testing women who are pregnant and newborns, people who are undergoing chemotherapy, dialysis, or requiring transplants, because my top priority is making sure no one in this province is left behind. Folks, this situation is unprecedented, and I can promise you, we're working around the clock to find solutions to the problems we as a province have never faced before. We've started by working directly with our partners on the ground, municipalities, charities, and shelters, to make sure they have the resources to keep their staff and residents safe. And in the coming days, we'll provide more detail in the next phase of our plan to further support these communities. The challenges we're facing from COVID-19 impact every person in this province. If it's a financial impact, mental impact, physical impact, we will be there to support you. Let me finish by saying this. I know that each and every family that have lost a loved one is grieving right now, and I grieve with you. I know that people are worried about their next paycheck, and I worry with you. I know that people are anxious staying in their homes, and I share that anxiety with you. And that's exactly why I'm working around the clock. That is why my staff is working around the clock, and that is why the Ontario Public Service is working around the clock. We won't stop working for each and every one of you. Thank you, and God bless the people of Ontario. Thank you. I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. From the beginning of the outbreak of COVID-19, we've been firm that the health and well-being of our people must be our #1 priority. We've been hard at work planning for every contingency, planning to respond to any scenario. To truly honor our commitment to safeguard the health of Ontarians, we have at all times operated under the assumption that the worst will occur and have planned accordingly. We have taken nothing for granted, including working with Ontario's hospitals to create unprecedented capacity at remarkable speed. Because of these efforts, Ontario has added more than 1,000 acute care beds, with the potential for an additional 4,200 beds by April 30th. The total number of acute care beds now stands at well over 20,000. There are now 3,500 critical care beds in our hospitals, nearly 1,500 more than when the outbreak started. Of these beds, more than 2,800 are now equipped with life-saving ventilators, up from 1,300 just a few short weeks ago. These considerable efforts have been organized in coordination with pandemic staffing plans to ensure that each hospital has the physicians and staff needed in case of a major surge of cases. As part of this expansion, we are redeploying surgical nursing staff who can now work with medical units, sharing highly trained emergency department and intensive care unit nursing staff across units, sharing physician resources across hospitals in a given region, recruiting family doctors to complete shifts within the hospital, and recruiting retirees, including nursing and support services personnel. All told, we are prepared to respond to a surge in cases should it occur. We are ready to protect the health and well-being of Ontarians. Before I conclude, allow me this opportunity to thank our partners on the front lines, the Ontario Hospital Association, the experts at the COVID-19 command table, and the leadership of Ontario Health for helping to build this new capacity. Long before any of us had heard of COVID-19, our government launched an ambitious project to break down the long-standing barriers that have for decades now locked the expertise of Ontario's world-class health agencies away in silos. That project culminated in the creation of Ontario Health, a new agency that brings together the combined knowledge, strengths, and experience of up to 20 existing health agencies and the many talents of their highly skilled staff into one integrated organization. In doing so, Ontario's healthcare system has benefited immensely, as Ontario Health has demonstrated a degree of responsiveness and shared purpose not previously imaginable. Indeed, looking at the significant capacity created in our hospitals in such a short period of time, it's clear that we have all benefited. Thank you.
We talk a lot about heroes during this pandemic. There are many heroes in communities across Ontario. These everyday heroes go above and beyond every single day, no matter what. And there's a special type of hero that I want to recognize today. They're superheroes, in my opinion. These heroes are known as personal support workers, or PSWs. To all the personal support workers, I'm speaking directly to you from the bottom of my heart. Thank you. When I speak to people about long-term care in Ontario, the one thing they all have in common is stories about a personal support worker that impacted the life of their loved one in a big way. And I have those stories too. And as we continue our efforts against COVID-19, we are seeing how this virus is unfolding in a vicious way across the world. Long-term care homes around the globe are on the front lines. And yesterday, we launched our COVID-19 action plan for protecting long-term care homes. And today, I want to provide you with an update. In the last 24 hours, we have seen 5 hospitals in Toronto band together to support 38 long-term care homes. This is the model that we will be expanding across this province. Issued guidance to hospitals to temporarily stop the transfer of patients to long-term care homes, and worked with public health to complete risk assessments for all 626 long-term care homes to ensure that resources are most effectively deployed, and issued new guidance to long-term care homes and retirement homes on usage of masks. Updated guidance documents regarding new long-term care home testing strategy and outbreaks in long-term care homes to reflect our new action plan and emergency order, building on our previous efforts. And we will continue to take decisive action in our efforts against COVID-19 in our long-term care homes across Ontario. Everything is on the table, and we will spare no expense to keep our most vulnerable people in long-term care safe.
We'll go to questions. First question.
First question comes from Lisa Shing from CBC. Please go ahead.
Hi there, Premier and Ministers. On long-term care workers, only working in one home. That order starts in 1 week, April 22nd, and the measure will only last for 2 weeks. And we're also learning temporary workers are still able to work between different homes. Now, if we look at, say, British Columbia, it stopped workers working between homes much earlier by paying all of them full-time wages. And their emergency measures last for the duration of the COVID pandemic. So why aren't we going further to get this right?
So we started this through the recommendation from the Chief Medical Officer of Health 4 weeks ago. It was strongly recommended. We wanted to take additional measures and make sure that there was providing even more safety for our long-term care home residents, and that is why the emergency order has been declared. For the staff in the long-term care homes and the operators of the long-term care homes need time to adjust to this. Some employees will have to choose. If they're not already working in one home only, they will have to choose, and they need time to give their employers their decision, and for also the employers to be able to have enough staff. And that's why this was put together with the staffing strategy as well, in terms of workers coming from the home care sector or hospitals and the other supports we've put in. In terms of the agency workers, we know that many homes have been struggling before this pandemic came to be in terms of staff. And that's what our ministry, the Ministry of Long-Term Care, was working very hard to resolve that issue when this pandemic broke. So in the context of a pandemic where staff may have to self-isolate, we needed a group that could be able to provide the safety for our residents in long-term care through shoring up the capacity of staffing. And that's why the agency workers were not included. They will, and I should add that they must adhere to strict and rigorous screening. That has to be across the board. But this was allowed our long-term care homes to be able to maintain the staffing that's necessary, particularly right now.
Thanks very much. And my follow-up more generally is the fact that we're now seeing outbreaks in more than 100 long-term care homes. Mm-hmm. So why did measures we implemented weeks ago, like screening, fail to stop those infections right at the door?
Yes, and that's exactly what our Chief Medical Officer of Health and Public Health is looking at with our targeted screening in select homes to understand how elusive this COVID-19 is and what else we can do, what other tools we have for this. Obviously, it's testing, but it is asymptomatic spread, and this has never been seen before. COVID-19 is a new type of virus. Typically, pandemics are influenza, but in this case, it's a new virus with a new way of spreading. And this is a global phenomenon in long-term care across Canada. High rates of mortality amongst the over 80-year-old groups to begin with, and whether that's in the community or long-term care homes, but this is a global phenomenon, highly impacting our long-term care residents and homes. It's tragic and it's unprecedented. And we rely on the advice and recommendations and directives of the Chief Medical Officer of Health, the best minds responsible for the scientific evidence and medical evidence that we have.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hello, Premier. My question is for you today. It's been almost 2 weeks since you released those modeling numbers with best worst case scenarios, and things have shifted. We're seeing like a 6%, we're hovering around a 6% increase in cases every day. We didn't hit those catastrophic ICU numbers. When are we going to get the new modeling, and where do you see us overall in this battle when it comes to the curve?
Well, Cynthia, I give all the credit to the 14.5 million people in Ontario that practice social distancing, self-isolation. That's the reason we're in a relatively half decent. I'm not even going to say the word good, because we aren't. This could come back and bite us in the backside in about 10 seconds. So we have to be very cautious moving forward. On more modeling, what I understand, and I will confirm it, we're going to be gathering more numbers this week, and hopefully sometime next week. they'll have some more modeling, but I'd like to confirm that first with the command table.
Okay, thank you.
Thank you.
And my second question is, and this was raised by my colleague Faiza with you last Friday, the province is not collecting race-based data on people, on the numbers being impacted by COVID-19, nor is the province collecting data per postal code. And my question is why? Shouldn't we be looking out to see if the vulnerable communities are being more heavily impacted? And there are greater calls for collection of race-based data. Would you consider doing that, and why aren't you doing that?
Well, not so much race-based, but we are looking at regions, so it automatically is area codes that we see the hotspots until we can redeploy our resources, no matter if they're health resources or just simply communication. But we do have a map that shows us where some of the hotspots are throughout the province. And we're redeploying the resources needed in those areas, but also communication, making sure that if we see a tremendous amount of cases in one area, we have to pick up the communication to make sure that people are self-isolating and practicing social distancing. So we do have a map, and we can see where the hotspots are, we can see what area code they're in, and we can redeploy the resources that they're needed.
Next question.
Next question comes from James Moore from News Talk 1010. Please go ahead.
Hi, good afternoon, Mr. Premier. Could you just talk about what you are going to do to supplement the rent relief program that was announced for businesses by the Prime Minister?
So we're going to be on a conversation with the premiers and the Prime Minister this afternoon. We're also going to bring this discussion to the cabinet table after that meeting and see how we can support these folks there. We do need the support of the federal government, as I mentioned yesterday, and we'll see what they bring to the table. But I think they definitely need some support, both the businesses and landlords.
And, you know, I know it's early, but can you give us any insight into whether schools are going to go back to being status quo when school eventually starts up again? Like, would the expectation be that fewer students would be in the classroom at a time?
Well, I think that's a little premature right now, James, but let's see what the minister rolls out over the next little while and base it on that, and base it on definitely what the Chief Medical Officer has to say.
Next question.
Next question comes from Christina Tenaglia from CP24. Please go ahead.
Hi,
Christina.
Hi, Ministers. I wanted to ask you about the change in the way that testing data has been reported. Premier, you referred today that the quota had been met in terms of number of tests, but you also talked about testing people.
That's right.
From what we understand, previously, the numbers that were provided on the Ontario government's website showed the number of people tested. Now it's the number of tests, meaning, you know, somebody could have been tested 2 or 3 times. So are the numbers now accurately reflecting what's happening out in our communities, and why this change in the reporting of the data?
Well, first of all, they're accurate numbers, and I'm going to let the minister explain it, but you pretty well explained it, Christina. We're testing some people a couple times, maybe a week later, but they should still count as a test, and that all depends on their situation. But I'll pass this over to the Minister for you.
Well, in actual fact, this doesn't have a significant impact on the number of tests conducted. We are up to 9,000 tests. The number of people who have been tested more than one time are not significant in terms of the number. What's more important is that we've really expanded, first of all, our capacity to test, and we've expanded the number of people that we're testing, and in different locations, in long-term care homes, frontline healthcare workers, working with Indigenous communities, working now with essential service workers. We're expanding that capacity, and that is what relates to the significant increase in the number of tests that are being conducted. And it really brings us more in line with what most of the other provinces are doing and the way that they're reporting, principally British Columbia.
Thank you. I'm wondering if I can ask about something you talked about yesterday, that within 24 hours,
long-term care homes in the province would have the PPEs that they need. On the topic of PPEs, do all the long-term care homes in the province at this point or by the end of the day today, will they have the PPEs that they need? And what about a group home like Participation House that needs PPEs? Thank you.
Well, first of all, the long-term care, even on the weekends, we were able to get it in most cases over within 24 hours. And unless they're not reporting in, which I don't believe they're not doing that, but if they report in, they need PPEs, we're going to have it over there immediately for them. And Participation House, similar situation. We want to make sure that everyone in Participation House and developmental services, they have the proper PPE items that they require as well. So if they don't, my word is please contact us and we'll make sure that we get the information over. But a very important message, since you've mentioned this, it's absolutely critical that all long-term care, seniors, developmental services, they report into us on their usage, their burn rate per se, until we can start measuring what the usage is out there, and it gives us a better idea on what long-term care needs as a whole, all 626 homes and retirement homes. So it's so important, it is so important that we need to see the usage every single week from these homes and report into us, because that's the only way we can manage it properly, seeing their overall usage.
Next question.
Next question comes from Mark Douglas from 680 News. Please go ahead.
Thank you. Minister Elliott, you mentioned today how the province needs to be ready for a surge of COVID-19 cases and hence the hospital bed expansion announcement today. I'm wondering, what's the upper limit of hospital capacity? Will there be another bed expansion coming? Will there be more hospitals built? You obviously can't have one bed for every COVID-19 patient in Ontario. So what's the upper limit here for Ontario hospital capacity?
We have been building capacity since the first case of COVID-19 was detected in Ontario, and so we are able to move very quickly to increase the spaces across the province. Some hospitals have chosen to increase capacity by renting hotel space. Grand River Hospital is one that's proposing to do that. Some are proposing to build a more tent hospitals. That's one has already been created at Joseph Brant Hospital. Others are creating more field hospitals, Winnebago. Some of the other units are doing that. So it differs in different parts of the province. But what we're waiting to see is hotspots that may develop where we need to increase the capacity. We can do that very quickly because we are ready to go. We have the plans in place. We have the teams ready to move in with that. But in addition to the physical capacity, we're also expanding the human resource capacity. That is with the portal that's been open to allow people with experience to come back, retired nurses, medical students are helping us with contact tracing, and others are coming forward helping physicians coming to work into our hospitals. So we are ready. If we see a surge in a particular part of the province, we are ready to move immediately to increase capacity, both in terms of space, but also in terms of human resources.
And then, thank you, Minister. And then just to follow up and just sort of to amend my earlier question where I said you can't have a bed for every COVID-19 patient. It almost sounds like you are, sorry, yes, this is another question for Minister Elliott. It almost sounds like you are suggesting that there could be a bed for every COVID-19 patient in Ontario. Is that feasible?
Yes, we are planning for a surge in capacity. We don't want to end up like some other countries have ended up where they've run out of supplies. Ontario is ready. As I said earlier in my remarks, we've planned for the worst case scenario and have planned for that. So we are ready. We have ventilators now for 2,800. We are working with the auto parts manufacturers to build another 10,000 respirators. So we are still building our capacity because we don't know. We haven't hit the peak yet, so our Chief Medical Officer of Health tells us. So we need to continue to be able to plan, to be ready, and to make sure that if we do have a number of patients, a significant increase in patients, that our hospitals will be able to accommodate patients.
Next question.
Next question comes from Travis Danrash from Global News. Please go ahead.
Hi there, Premier. Prime Minister Justin Trudeau said the Quebec government has asked for the federal government to assist with long-term care homes in that province, and Ottawa is looking at the possibility of sending in military help. Has Ontario asked for help from the military, and if so, why not?
Well, we haven't asked as of yet, but everything's on the table. We won't hesitate if we feel that's a requirement from the command table that they need their support. They'll be there. We won't hesitate to ask for support, no matter if it's even contact tracing, as the military has offered. So we won't hesitate to ask for the support if needed.
Okay, my next question is for Minister Fullerton. Dr. David Williams, when asked yesterday, said policies around long-term care facilities are determined by the Ministry of Long-Term Care. You said just now that you are relying on the advice of him. So it seems as though the buck is being passed around from this 1 o'clock news conference to the 3 o'clock news conference with him. Who makes the ultimate call, and why didn't the ministry act faster to implement some of these changes that won't be in place until next Wednesday?
So for the emergency order this time requiring staff to work at only one home, that gradual time over a span of a week was to allow the homes to adapt so that they were not left without staff. And so that was a very, very important consideration. Let me just clarify, the role of the Chief Medical Officer of Health and Public Health, they have a very specific job to do. They are the people who work, and I was on the Board of Health for a number of years in Ottawa, so I understand this very well. They act on the scientific information and medical information and the evidence, and they will make recommendations to the ministry. They also issue directives. As a Ministry of Long-Term Care, we have levers in there that are regulatory, and we can adjust those levers. But let me make sure that everyone in Ontario knows how closely we've been working with the Chief Medical Officer of Health and Public Health in a timely way to understand every single measure that we can take, particularly that is science and evidence-based. So I'm pretty sure that you want people who are up to date on all the science and evidence, and the politicians can do their regulatory work, and that's the division.
Next question.
Next question comes from Rob Ferguson from the Toronto Star.
And you have been listening, sorry we lost the signal there, but you have been listening to Ontario Premier Doug Ford, as well as his ministers for long-term care and his health minister, giving us an update on the situation in Ontario. There's been lots of talk about ramping up testing. The Premier saying that 9,000 tests were performed yesterday, and that is moving towards the goal of 14,000 tests by the end of the month. There had been a lot of criticism that there had not been enough tests